Welcome to the Limitless Legal Nurse Consulting Podcast. I'm your host, Anna Gray. The best thing about being a nurse and entrepreneur over the last 25 years are the relationships I've developed and the people I've met. As a legal nurse consultant, I wanted you to hear from those amazing people in the legal and healthcare communities. I wanted you to hear who they are and to celebrate them with me. Get ready to be inspired, informed, and empowered. Let's dive into the Limitless Legal Nurse Consulting Podcast. Hey everyone, welcome to the Limitless Legal Nurse Consulting Podcast. I'm really excited about my guest today for many reasons, but one, because she came referred. This is one of my favorite things now, is to get referrals from past podcast guests on who I should have a conversation with. So Savannah, thank you so much for being here. You were highly recommended.
Aww.
And I'm really looking forward to getting to know you better and your story and everything about you. So thank you so much for being here. I appreciate it.
Thank you so much for having me. I'm so excited.
Yay. Okay, let's dive in. Now, if you've heard my podcast before, I like to start with like where you're coming from. Where in the world are you coming from?
I am from Wisconsin. I'm right in between Chicago and Milwaukee.
Yeah.
My husband works in Chicago. I work in Milwaukee. So it's kind of like a easy commute. Not really easy for both of us.
Yeah.
And yeah, I've always lived in Wisconsin. I am a cheesehead. Ride or die.
I love it. I can appreciate that. I'm a hockey player. So I've been up to Wisconsin a few times. Been up to Green Bay. I played hockey up in Green Bay a couple years. So I'm a big fan of Wisconsin. And actually, I've met a lot of legal nurses from Wisconsin. It's kind of a cool state.
Yeah.
Okay, so you've always lived in Wisconsin. Have you always lived where in the city you live in now, or have you kind of been all over the state, or what does that look like for you?
I grew up in Kenosha, Wisconsin, which is right in the corner.
Mm-hmm.
And then I went away to college in like Fox Valley, so just a little bit south of Green Bay.
Mm-hmm.
And never imagined that I would move back to this area, but my husband reeled me in, and here I am back in the southeast corner.
Right.
So I am kind of back to my roots. I'm just one town over now, basically.
Yeah.
But if you are ever driving like into Wisconsin, do you drive when you come here?
No, I usually fly. Well, sometimes. I've flown into Minneapolis and have driven up.
Oh, okay.
Wisconsin.
So there's like a big like tourist trap right as you cross the border. It's called Mars Cheese Castle. And that was actually like my first job.
Oh my gosh, that is fantastic. I love that. Okay, I have not seen that, but now I will always be curious. That's awesome. Okay, so you went away to school. What did you go to school for? Did you go to school for nursing? Did you?
Yep. I always knew I was going to do nursing. I have always had a passion for women's health. The program that I went to was one of like the best in the state at the time. And like that was where I was like dead set on going. And it was actually kind of neat because I could change my courses around what I wanted to do and what interested me. So like, for example, like my OR rotation, like med surge, I got to follow like a breast surgeon who did a lot of like breast surgeries and reconstructive surgeries. For my public health, I did like a women's clinic, like WIC. I also did like a STD clinic. I got to do labor and delivery. I always knew I wanted to go into labor and delivery. When I was a senior in college, I got a job as a nurse intern in a very busy tertiary care center in labor and delivery. And I was at that hospital for 15 years.
Wow. Wow.
Yeah,
okay, so let's go back. Yeah, no, let's go back in high school. So you said you always wanted to go into women's health. Was there something that you experienced? I mean, you don't have to go into detail, but what was because I know for me, I had no idea what I wanted to do in high school when it came. I mean, I'm one of those ones that kind of what got into nursing later. But I've met quite a few people that have jumped into nursing straight from high school, which I find fascinating because it's typically what you're exposed to beforehand. So what was that like for you to make that decision of number 1 going to nursing school and number 2 knowing that you what kind of specialty you wanted to go into right away?
Well, I was a CNA in high school. I took
Mm,
courses in high school that I got college credit for as
mhm,
well. And so I had like advanced A&P and biology, and um, I was really into art. And so I got a lot of my like humanity credits met with that. And I really liked being in healthcare as a CNA.
mhm.
And I just thought it would be like a really good opportunity and I could kind of go anywhere with it. And once I got into my freshman year, I knew that I wanted to do labor and delivery. I heard a group of midwives talk about it, and I was like, yep, that's it. That's what I'm going to do.
Interesting.
And so I got into clinicals my sophomore year and um, got my BSN.
Yeah. That's great. And I'm sure you had really great mentors along the way
Yeah.
that kind of knew. Um so okay, so then so you got a job right away
Yep.
and you were there for 15 years. Tell me a little bit more about that job and your experience in there. Um, Obviously you had a passion for this, so they took you in with open arms. Did you ever really obviously you had a really great experience, but tell me a little bit about your experience and in working there and kind of the community around that and really what kept you there for that long?
Yeah. So when I first started, there was like no new nursing positions. Like everybody had been on that unit for years, and the nurses that trained me were there for like 30 plus years. And when they took me in, they were kind of rough, but they said, "We are going to train you so that you can deliver our grandbabies." And I just thought that was like really special because like they wanted to make me into a nurse and mold me into somebody that would feel comfortable, that they would feel comfortable like taking care of like their precious grandbaby. And like I
Mm,
just thought, wow, that's like really cool. And
yeah.
so, man, they were tough, but I learned so much and it was great. And I love those nurses. I am so thankful to them. There a lot of them are retired now. And I like still keep in touch with them. I see them all the time, and I owe so much of who I am as a nurse today to them. And then every nurse that I precepted after that, I'm like, I'm going to make you a nurse
Right.
that I would feel comfortable delivering my baby. And
Yeah.
two of the nurses I precepted delivered my second
Oh,
child.
wow.
So it was
Yeah.
really special. It was like a full circle moment. And I have like so
Mhm.
many pictures from my delivery. And like my
Mhm.
delivery room was full of nurses. And
Wow.
it was, like if you have a delivery room full of nurses, that's usually really bad. But like
Right.
it was wild in there. Everybody was like laughing and cheering. And it was just such a great environment. And I
Mhm.
remember when I first started, there was a nurse that was pregnant there, and she had like another coworker check her, and I was like, "That's crazy. I would never want my coworkers to see my lady
Right,
this,
right,
like
right, right,
never."
right.
And I thought that was so weird. But then I just saw like that's exactly who I would want to take care of me.
Yeah,
I trust them. I
yeah,
trust them with my patients. I know exactly how they practice. I know that they would advocate for me, and
right.
so I delivered both my babies on the unit that I worked.
Oh,
Um,
yeah.
I have also had like other jobs within the hospital, so it wasn't just labor and delivery. I was a
Mhm.
sexual assault nurse examiner in the ER.
Mhm. Mhm, mhm.
And then I did maternal child home health for 1 year. I hated
Mhm.
that.
Why did you hate that? What was it that you
Um,
didn't like?
so I would get to see all of like the NICU graduates.
Yeah.
So every baby that was discharged from the NICU that the nurses were like, oh, this one could probably use some extra help at home. And
Right.
maybe don't like trust the mom. Or maybe like mom was totally fine, but just like needed a little extra hand holding.
Mm-hmm, mm-hmm, mm-hmm,
Um, I would get those referrals.
mm-hmm.
And then I would have like wound vacs
Oh
for
yeah.
C-section wound infections,
Yeah.
not
Yeah,
my
yeah,
jam.
yeah. Wounds. Yeah.
Um, I would do like TPN for moms that had really bad hyperemesis.
Mm-hmm.
I would also get kids from our children's hospital that needed like their lines accessed for labs,
Mm-hmm.
if they had like cancer or other like
Right.
chronic health problems. But all of my patients had my cell phone number because
Oh.
they all needed to get in touch with me. And
Yeah.
the only way that they could was really to
Yeah.
text me because nobody's going to answer like an unknown phone number. And
Right. Right.
so I would get texts in the middle of the night all day.
Oh
And
yeah.
like some of these people were not doing like a very good job taking care of their kids, like not
Right.
filling their oxygen if they had like chronic lung. And
Right.
so, you're a mandatory reporter as a nurse, like if
Mm-hmm.
a
Mm-hmm.
child is being neglected. So I would
Right.
get like calls like, did you call the people on me? And I'm like,
Oh my gosh. Oh man.
so I left that after a
Yeah.
year. I just had like a really devastating case,
Yeah.
patient, and
Yeah.
the baby actually died in
Oh.
the home. And
Mhm.
I was just like, I can't.
Yep.
And a position had opened up in maternal fetal medicine, which is a high risk OB clinic.
Mm.
And so I took that position, was there for 10 years. I was already working per diem there doing like non-stress tests, but
Right.
I slipped into a more permanent role there, and I was there for 10 years
Yeah.
before leaving to go to a different hospital, which I'm currently at.
Which you're currently at because
Yeah.
you picked up and moved. Yeah.
Yeah,
Yeah.
it's a bigger hospital
Mm.
system with some more resources, and there was a lot of like leadership changes at my old
Yeah. Oh,
hospital.
right. Right. Right.
We
Right.
were gifted to like a different health system. And
Yep.
when we were gifted, I feel like
Yep.
a lot of our like core values changed. And
Yeah.
I didn't love that anymore.
Yeah. Yeah. Did you ever go into leadership there besides for a
I was like
preceptor?
a charge nurse for
Yeah.
many years,
Yeah.
but I never wanted that role.
Right. Yeah.
I was just kind of,
You enjoyed your patients. You
yeah,
didn't want to be a babysitter.
yeah.
Uh,
And when they put me in charge, they put
yeah.
me in charge of like other nurses that had been there longer than me, and that like put a very sour taste in their mouth.
Oh
But
yeah.
the mentors that I had early in my
Mm-hmm.
career and like
Mm-hmm.
the leaders that I
Mm-hmm.
had saw
Mm-hmm.
something in me,
Mm-hmm.
and it gave me some really good experience,
Mm-hmm.
and uh toughened my skin a little bit,
Right. Right. Right.
and
Right.
it helped me. It
Yeah.
helped me blossom into
Yeah.
the
Yeah.
nurse I am today.
That's right. They're all lessons along the way.
Yeah.
Okay, so where you're at now, are you in similar role?
Yeah. So I am in maternal fetal medicine,
Mhm.
and it's a clinic, but we do our own OB care. So the patients that I take care of are like very high risk. Like patients that are pregnant on dialysis
Oh yeah.
or
Okay.
have like heart failure,
Yeah.
like very poorly controlled diabetics, poorly controlled hypertension, all kinds of risk factors.
Right.
And so we do OB care for all of those patients, but we also do consults for patients that other doctors refer to us, like, hey, I just want you to talk to this patient about their history that is significant for this.
Mhm.
And so my job as a nurse in the clinic is to look through their chart and gather all of the information that I anticipate my doctor is going to need to consult them on this specific condition. So
Right.
I'm like basically like writing the consult, like putting it in this nice little presentation
Right.
for the maternal fetal medicine doctor to then tell the patient
Right.
about.
Yeah.
So that really helps me a lot in my
Yeah.
legal nurse because I know exactly what I'm like
Right.
looking for in charts
Yeah.
and
Yeah.
what should have been done and
Mhm.
what kind of tests were needed and what the management of those
Right.
comorbidities looks like.
Right. Right. That's fascinating. Um, okay, so tell me a little bit more about how you got into legal nursing because it does seem like it's a pretty straight shot of, oh, this makes sense. How did that occur?
Well, that's a good story. I mean, not like good, but
Yeah, yeah, yeah.
so my uncle had asked me to be his power of attorney um, and like executor of his estate if something were to happen to him when I
Mhm.
graduated from nursing school. Like him and I were very close. He's actually my godfather, like a father figure to me. I would call
Mhm.
him whenever I was in trouble and
Mhm.
he would
Mhm.
help
Mhm.
me.
Mhm.
And I agreed. I thought it would be when he was like, 80 years old in a nursing home. But he called me one Wednesday night and he's like, "Hey, I'm having really bad chest pain. What should I do?" Well, I was like, "Well,
Mhm.
pop a couple aspirin and go to the nearest hospital." So he went to the hospital and they kept him overnight. He had some elevated blood pressures. And so they said, "We're going to do a stress test on you the next day." So they did a stress test the next day with an echo, and they were like, "It looks like you need a cardiac cath."
Mhm.
So the cardiac cath was the following day, which was a Friday. And I went in to visit him. And it was after the cardiac cath that they said, "Oh, he has blockages in 3 arteries and he needs 3
Cabbage.
bypasses.
Yeah.
And so we're going to do that tomorrow." And like his face had like all these cuts all over. And I'm like, "What happened to you?" He's like,
Mm.
"Oh, I shaved." And I was like, "Well, you're not clotting." Like they loaded him up with
Yeah.
Plavix when they
Right,
came
right,
on
right, right,
Wednesday.
right.
And I said, "Is this an emergency? Like, does he need to have this surgery like tomorrow on a Saturday when there's not as many resources?"
Yep. Mhm.
And the surgeon was a locum and the 2 cardiac PAs were like, "I think you could probably wait until Monday. This isn't an emergency." And I was familiar with the hospital system because I had worked
Mhm.
agency there.
Mhm.
And I
Mhm.
knew that there were more senior nurses at the other campus, and there was like
Mhm.
a cardiac ICU at the other
Right.
campus.
Yep.
And I could just sense how busy the ICU was in that he was at.
Yep.
And so I asked for him to be transferred to the other hospital and they said, "Yeah, that's fine. We'll transfer him." So he got transferred on a Friday
Yeah.
and I brought like donuts in to bribe the nurses and I was like,
Mhm.
"Hey, nurse to nurse, like
Yeah.
do I need to have him transferred to this other place in Milwaukee that does a ton of these
Right.
procedures? Like, what do you think?" And they were like,
Mhm.
"Honestly, this doctor was here last year. He did okay. There was a couple patients that we thought would for sure die, and they lived."
Mhm.
And I gave it to my uncle and was like, "Well, what do you want to do here?" And he's like, "I feel like this is where I'm supposed to be."
Mm.
And
Mhm.
so he had surgery on Monday. The plan was to call me when he went on pump.
Mhm.
And then when he was done and extubated, and I would come meet him. And so I went in Monday morning, prayed with him, saw him off to surgery, and his last words to me were, "Oh, I'll see you on the other side." And I was like, "I will see you right here at 5 o'clock,
Yep.
extubated, and I'm getting your butt out of bed."
Yep.
So I was at work and I just had this like
Mm.
feeling around
Mm.
noon, like something was going on. And so I called the ICU and I asked to talk to the nurse that had been caring for him all weekend. I built like
Right.
a really nice rapport with her. And I was like, "Hey, what's going on with my uncle?" And she was like, "Okay, let me look in." So she could only see like the gases that they were doing in the
Mhm.
OR.
Mhm.
And
Mhm.
she's like, "It looks like he's doing okay. I can't really tell much, but he's definitely on pump. So like the procedure has started
Right.
and, I'll keep you updated. I'll keep watching." And so like my uncle is actually one of 10 kids. my dad being one of them.
Mm-hmm.
So I was then in charge of updating his 9
Everybody.
siblings.
Yeah. Okay.
So I like sent a text message out to them or an email and was updating them all what was happening. And then at 4 o'clock, I got a call and it was the nurse. And she's like, hey, you might want to come in. And I said, oh, is he going to be done soon? She's like, I'm not sure, but he's gotten quite a bit of blood. And I was like, well, how many units? And she was really quiet. And I was like, are you still there? And she's like, yeah, I'm counting. So at that point, he had already received like 22 blood products. So she's like, I'm just calling you like nurse to nurse, like you should probably come in. And so I had my husband come get me and we drove to the hospital. And on the way to the hospital, the doctor called me and he's like, hey, I don't think your uncle is going to make it off of the operating room table. Every time we take him off pump, his heart just blows up and like the grafts tear right off. And I was like, okay, I mean, just kind of like stunned, like he was only 55. I didn't anticipate that. Sure. Like his echo the day before was great. Like
nothing crazy.
It wasn't an emergency surgery. I wasn't anticipating that. So I had to like update his siblings. And so I sat at the hospital and they worked on him until late at night. And they said, you can just go home. We'll call you because he's so unstable. We couldn't even close him up. He's still got like everything is open. He's got a wound vac on. And like, if he makes it through the night, he'll have to go back to get it closed tomorrow or whatever. And I was like, well, I'm not leaving. And so 15 minutes later, they're like, you can come in the room now. Well, when I walked in, his blood pressure was like 38/20. His pupils were like fixed and dilated, and he had the most edema I had ever seen in my whole entire life. He looked 100 pounds heavier. And they were like, he has a pacemaker, and the pacemaker is just what's keeping him alive. He's not here. So I had to withdraw life support. And I knew he wouldn't, want to live like that. You can't. And so the family all came and said their goodbyes, and then the nurse came in to like clean him up, and I was just kind of like helping her. And I could just tell like something was off at the nurse's station. As nurses, we can read a room pretty well.
Oh yeah, for sure.
And I like the cardiac PAs that I had like bonded with all weekend wouldn't even look at me. They were like mad. And I'm like, what happened back there? And she's like, I don't know, but I think that you should look into it. And like, as a nurse, you can like, can you imagine yourself ever having that conversation with a patient? Like,
no, I know.
But I like had really bonded with them that weekend. And so I got his medical records as his personal representative. And I combed through them and I figured out what had happened. And there was like a couple notes from the perfusionist that looked like he was miscannulated. And the perfusionist wrote, surgeon notified several times. I'm like, oh, so I don't do hearts. Something's not right here. I feel like there's something going on. And I don't know. I wrote letters to risk management asking, like, can we have like a meeting? I just want to know what happened. He went into DIC. Was there like some kind of precipitating thing that happened here? It looks like he was maybe miscannulated. And so like a few months later, they had me come in for a meeting. And this was a hospital system that I was familiar with. I knew the risk manager and I knew the VPN because her husband owned Marsh Cheese Castle.
Oh.
And so I knew what was happening. And they were like, you just really cared about your uncle. He was just sicker than you thought. And I had asked the surgeon, can I have an autopsy? And he was like, yeah, sure. And so the next day when I was at the funeral home, the medical examiner called and he said, yeah, we're not going to do an autopsy. And I was like, what? Why? And he's like, I talked to the surgeon and he said that your uncle was just like very sick and you're just not believing how sick he was. And I was like, he was 55. Like
Yeah, no,
his
yeah.
BMI was like 31. I mean, he was a
Yeah.
little overweight, but
Mm-hmm.
he had his CDL. Like he didn't have like these,
Right.
you know, you have to have a yearly physical with those. It's
Yep.
not like he had all these comorbidities. And so he said you could hire a private pathologist and that's like $5,000. I'm like, well, it's not going to change anything, you know? So I didn't do anything, but I just wondered why it was so secretive.
Yeah.
And so after my meeting with Risk, I just felt like really defeated and I left it at that for a while. And then as fate would have it, my best friend was working in a different hospital OR and they got a new first assist.
Mm-hmm.
And she said he was talking about this really bad cardiac case that made him leave. And it sounded like your uncle. So I said, hey, was that Randy Wilkham? And he got white. And she's like, I know somebody that wants to talk to you. And he's like, I can't say anymore.
Yeah.
So he ended up meeting me at Starbucks and he's like, you're 100% right. What you think, because he was like, tell me what you think happened. And so I told him, he's like, you're 100% right. This doctor should not be operating. He had an essential tremor. He wouldn't allow either of the cardiac PAs to like help with anything. He was miscannulated. For 30 minutes, there was alarms going off and he was like ignoring everything. He's like, we sat there front row and we felt like we were just like watching your uncle die. And he's like, it caused so much trauma to all of us that the two cardiac PAs left. I left, and he was a first assist for like 20 something years.
Mm-hmm.
And and all he did was cardiac.
Mm-hmm.
And so he's like, and that was the straw that broke the camel's back because there were other issues as well. There was other patients that died. And so I was like, well, something has to be done about this. I can't in like good conscience, like just be like, oh, okay.
Right.
So I like made my own little version of a chronology, had no idea what legal nursing was at the time. And I sent it over to like a med mal attorney.
Yep.
And they called me back. And Wisconsin has some pretty crazy like laws on, medical malpractice and like the caps that you can get. And it's not that I was looking for money. I just wanted it to not happen again.
Yeah.
And so the attorney that I spoke with was wonderful. And she said, have you ever heard of legal nurse consulting? I think you'd be awesome. And I was like, I've never heard of that. I'll look into it. But she's like, you know where to hit them where it counts, right? And I was like, I mean, writing complaints, sure, but she's like, do it. You do you.
Yeah.
And so I wrote complaints to the Joint Commission, to CMS, to the Wisconsin Medical Board, and I complained about what had happened, and I included some other instances that the first assist told me I couldn't identify any of those patients. It's not like he told me like their names, but situations.
Right. Yep.
And I wrote all of that in the complaints, and I just got like, the standard letter. Thank you. We just want to let you know we're looking into it. Didn't know anything else. And then I don't know, probably 6 months later, I was precepting a new nurse in our MFM department. And she's like, yeah, I came from this other hospital in the cardiac ICU. Our unit closed. And I said, what happened? She said, the Joint Commission actually came in on a complaint and they put on all kinds of things in place that needed to be met, and they decided to just close the cardiac ICU and to stop doing cardiac surgeries because their certification was going to get pulled. And then a few months later, that hospital system was actually sold to another hospital system. So I felt like all of these pieces fit together. Like fate had like this crazy
Sure.
way of, a lot of people don't see that kind of like justice. And I feel like I actually really did change the
Yeah.
system.
Right.
And you don't get that
Yeah.
typically from,
No. Yep.
a med mal case. So I succeeded. I got what I wanted. And that was just for that to not happen to anybody else.
Sure.
And hopefully it didn't in the time between
Right.
when my uncle died and when they ended up losing their cardiac certification, or that was threatened and they um, stopped serving the cardiac patients in that area.
Right.
But yeah, it was a really strange turn of events, and I feel like it was like a sign that maybe that's what I should be doing, is like
Mm-hmm.
looking into this, because
Right.
as a family member, I just wanted
Mm-hmm.
to know what happened. Like if they would
Mm.
have come out and said like, yeah, we messed up and here's what we would have done differently and here's what we're going to do to make sure it doesn't happen to anybody else, I would have never taken those steps. I
Sure.
would have never looked into it. I
Sure.
I understand like nobody goes to work wanting to hurt somebody
Right.
in the hospital.
Right.
And but the way that I was just like gaslit was
Yep.
just wild. And I I felt like I was like, well, I was one of you guys. Like I'm on your team. Like just
Right.
tell me what happened.
Right. Right.
And so yeah, that's how I
That,
kind of got into it.
wow. Well, first of all, I'm sorry that you had to go through all of that because nobody should have to go through that, clearly. But I commend you for listening to your own, whatever it is, intuition that says, taking this further or just wanting to know the answers. And that's a really good perspective for us to take a look at. If we haven't been through something like that, is to really kind of take that approach. Like, maybe that's what people are just looking for. They're not looking for the financial, you know, aspect of it, but they just want answers. And I'm glad that you shared that that was really what your ultimate goal was, and obviously to protect others from letting this happen to them or their family members. So, wow, what a story. I mean, that's just I'm like still like in the story. I'm still sitting in the story here.
Yeah.
Um, and how long ago was that?
7 years ago.
Oh, wow. Okay. All right. Wow.
Yeah.
So after all of this kind of resolved, I mean, not, I don't know if it ever really resolved, but um, once you discovered that there were changes that were made, did you decide that this was something that you really did want to pursue, or did you sit on that and stew on it for a little while, or what did that look like for you?
I sat on it for a while. I
Mhm.
had taken like a legal nurse like course. It wasn't I didn't invest a lot into it.
Yeah.
It was just something that like piqued my interest, like, oh, maybe I should look into that a little more.
Mhm. Mhm.
And I kind of sat on it, but then I had like some health challenges going on, and after that I was like, this is what I want to do. This
Yeah.
is what I'm going to do.
Yeah.
Um I just kept feeling this like nagging
Yeah.
pull to go. And that's, probably one of my favorite parts of being a legal nurse, is like telling the story. And uh it the story is different, for every person. Sometimes there's a really bad outcome that happens, but
Mhm.
that doesn't mean that there was negligence.
Mhm.
And there are a couple attorneys that I work with that, if there is not merit in a case, I
Mhm.
actually talk with the patient and say, hey, I reviewed your case. and I want to talk about what happened because I want you to have the opportunity to ask questions. What happened actually, like maybe you got, I don't, it depends on the case, but like you actually got really great care and this is
Right.
why they did X, Y, and Z. And this is, you know, what probably led to this other, bad outcome. But I think that closure that patients get is really important too. And like they've told me, like it was really nice for somebody, in the healthcare community to like talk to me
Yeah.
about what happened.
Yeah.
Because like, yeah, what happened to me sucked, but now I feel
Right. They understand it
like I
a little
understand
bit
it more
better. Yeah.
and sometimes they feel like lied to because the whole story isn't told to them. And it's a
Right.
shame that, some patients have to go through that because it adds so much trauma to their
Sure.
birthing experience.
Yeah.
Um, but then, the cases that are completely avoidable and something really terrible happened, I get to tell those stories too,
Yeah.
and and help those patients on their healing journey, or those clients for,
Right.
for the attorneys so that they can get the justice,
Right.
for those
Right.
families.
That's an interesting not ta that's an interesting take on the fact that they have you explain that to their clients. I think it's I mean, I think that that should I don't know if it happens all the time. That's the first time I've heard that. But it makes complete sense because it's coming from you, someone that they know, has the training. It's different from saying, "Oh, the nurse I worked with said X, Y, and Z," which is fine, and I'm sure that that's what happens 99% of the time, but coming from that nurse, I'm sure gives those clients, patients, peace of mind. There's this extra layer of, like, trust that what they're hearing is what happened,
Yeah.
even though, obviously they trust their attorney, but there is something different about hearing it from the horse's mouth. Yes, I did review your records and here's what I saw and I hope that this feels, there is this extra layer of peace of mind, which I'm so glad that you shared that because that actually sparked my interest of offering that, to
Yeah.
be
And
that person
it
to explain
honestly,
it.
it depends on the case for
Sure, of
sure.
course. Sure, of course.
But I think that like the first time I offered it
Mm,
was because I could just like tell like how devastated this mom was
yeah,
over
sure.
this outcome that
Right,
she had, and there was no way of predicting it, and there was no way of
right,
stopping it. And actually her team, her healthcare team, did a really good job managing it.
right.
And so I was so familiar with like all the details of the case,
Yeah.
and I was, talking to the attorney about it. And I said, "Do you want me to talk to her?"
Mm,
And he was like, "What?" And I was like, "I mean, like when you talk to her, like do you want me there?" Like it was so awkward, but
yeah.
I just felt like
Yeah, yeah, yeah.
I'm so used to
Just pull
giving bad news,
right,
like I'm so used to having difficult conversations at work. I'm I'm this is this is
yeah,
what I this is what I do. Like
yeah,
I explain things to patients in ways that they can understand, and I'm happy to offer that to her.
yeah,
And he's like, "Well, that'd be great." So that was how it first started,
right.
and then that was just a merit screen that I did, and then the next case, I was like, "You want me to talk to this one too?" "Yeah, sure, sounds good." So it like that's what I find like really fulfilling sometimes too, is
Sure.
just still having that connection with like the patient, but also saying like, "Hey, I have experienced,
Mhm,
you know, a really preventable loss. And
mhm,
so I that's what got me into this work, because I do have a passion for, like justice when it comes to healthcare
Right.
and equal care for everybody. I don't want somebody, marginalized, or I don't want them to have bad care. And I'm there to like spot that kind of problem.
Mm-hmm.
And so I'm looking at it through that lens as like, somebody who has been there and is, working in healthcare and can spot that kind of thing. And I want you to know, like, as a nurse, what happened so that maybe you can understand it better, because what happened in this case actually, it ended horribly, but it wasn't preventable. And the way that you can just,
Yeah, your perspective
yeah.
helps them gain perspective
Yeah. Like, I'm not just
as a
another nurse
patient.
working for the
Yeah,
system telling them.
right. You have firsthand experience with
Yeah.
this kind of thing, which I'm sure absolutely helps them understand. And, lets you sleep at night knowing that, like you said, you're still able to be impactful. I know that we as legal nurses, it's different than obviously being bedside, for lack of a better way
Yeah.
to describe it. Um, but I know that you connect with a case, you connect with that
Hmm.
that patient, and you want to know what happens later. You want to know, how did this turn out for them, what happened for them. And very, for me, I know that it's very rare that you get to hear what happened. So I do always try and stay connected and want to know the outcome. But since these take so long sometimes, that it becomes kind of this, they forget to circle back with you. But I think we as nurses, that's what we want to know. That being said, I being an OR nurse, I'm kind of used to that. It's we don't know what happens to the patient. It's like you spend that amount of time
Yeah.
with the patient, and then they're off and running, and you don't ever hear what the outcome is. So I'm kind of used to that. But it would be great to have more closure and feel like, you've made a difference, even though, you know, we still feel like we did because we put our best foot forward, and we kind of pour our heart into it because we are nurses and that's what we do. Um, so I appreciate you sharing that aspect of it. Yeah, you have my mind like spinning on this whole side of it, but you also have that firsthand experience, which I don't have. But being a nurse for a really long time and being a first assistant, I've seen lots of things, and you know, being able to put that knowledge and share it with patients on the other side is really a gift. So I commend you for doing that and taking that extra step for those patients and the family members, and giving them that peace of mind, and giving yourself that peace of mind as well. Okay, so you clearly have a great connection with your attorney clients. You obviously do a lot of work in your specialty. What does your business look like now? You're working bedside still, or you're?
Yeah. So I am in the clinic 2 to 3 days a week.
Mhm,
And then I do all behind the scenes work on birth injury cases.
mhm.
So that's all I do.
Yeah.
All I want to
Okay.
do.
Yeah,
I don't
yeah,
want to touch
yeah.
anything else.
Sure.
When I first started, everybody was like, "Oh, you're gonna have to be a testifying expert if you want to like stay busy."
Mhm,
And I was like, I do not want to testify.
mhm,
No, thank you.
mhm,
Not for me.
mhm.
I would like to help behind the scenes though. And they're like, that's going to be hard. It's going to be, it's You're not going to get busy enough. And here I am asking my manager at work, can I please cut down? I would like to work 1 day a
Right.
week.
Because you're so busy, huh?
I am. I
Yeah.
really am. And that's all I do is behind the scenes
That's great.
birth injury. And I love it. I love sharing what I see. Of course, de-identified. Because I know as somebody who's been there, like I didn't want it to happen to anybody else. Like I wanted them to do a root cause analysis and they didn't. I found that out from the first assist. They never even did a root cause, even though they asked for it.
Yeah, for sure.
And so if I see common themes in birth injury, I feel like it's my duty as a nurse to like share that on with other nurses. So I, will do talks for A1 on, litigation. A1 is the, professional group for the Association of Women's Health, Obstetrics, and Neonatal Nursing. So I'll do that. But like I like to share what I see because I don't want it repeated. Like it would be great if I just like didn't have any cases and I could just like retire.
Sure.
Like I would love that. I don't want to see it happen to anybody. And I feel like it's nice to share what I see so that other nurses can learn from that.
Yeah.
Because if we don't talk about what happened, how do we learn from it?
Yeah, absolutely. Absolutely. And that's what, a good educator in healthcare does. It's really understanding, how can you help prevent this from happening. This is what, preceptoring is. This is what all of those things that I can relate to this very much. So being in practice and being someone that's been doing it for 20 something years, it's like you keep seeing the same things over and over. This is preventable. How do we fix that? So speaking up is an opportunity, hopefully, to, have that spread across, everyone you can touch. So, so do you do a lot of educating, obviously, outside of your legal nursing? Well, I love hearing your story. I love that you've shared all of that, and I think that that's really impactful for, I know, myself and those listening as well. And clearly they know who to go to. All of those legal nurses out there know who to go to for birth injuries. I know, top of mind. I've actually, we talked about this a little bit, but I've had other great guests on my podcast, and it's nice that we can share our knowledge. I know that you've shared knowledge with other legal nurses who speak highly of you. And so it's great to be a resource for others as well, because we're, I spent a day, in nursing school 20 something years ago in labor and delivery. And that's my experience, and I don't know anything else about it, so it's really great that we can rely on others to kind of help us through making things make sense. And we all have different strengths, and that's another reason why I love this podcast, is that it allows me to just be, someone that's having a conversation with someone that, I want everyone to see. I want everybody to see that you're,
Thanks.
this is your specialty, and this is your strength, and this is, you're there to help, and you're a resource. And yeah, that's one of my biggest goals, is to get people, seen. So I appreciate everything that you've shared. I look forward to staying connected in the future. Can you share with everyone where you can be found if, we need your specialty, or even just to pop over and say hello and, thank you for sharing this, because I know that that's what a lot of us like to do.
Yeah. So I'm on LinkedIn, Savannah June like the month. And I also have a website, savvylegalrn.com.
Okay, great. And we'll make sure that'll be clickable in the show notes. So you
Cool.
can easily find Savannah. Well, Savannah, thank you so much for being
Thank you.
here. I've loved our conversation and I look forward to staying connected in the future. So thank you so much.
Awesome. Thanks again for having me.
Thank you for joining us in this fun conversation on the Limitless Legal Nurse Consulting podcast. I hope you found this episode as inspiring and empowering as I always do. And I hope that you share this episode with your friends. If you enjoyed it, I would love it if you could leave us a review or comment, as I would love to share them in the future episodes. Or hop on over into my DMs and send me a quick message. I can be found on Instagram at anna.b.gray, on my website at limitlesslnc.com, and over on LinkedIn at Anna Gray. And I want you to remember, you are limitless. Until next time.